Hey, this is Chris, keeping it real, facts over fear. Yes, there's a bunch of numbers here, and they really won't make sense to you until you see the following video from Dr. John Campbell, who's in the UK. Lee and I went to the UK about 2 years ago, had a great time in Scotland, which really has no bearing on this video, just thought I'd throw that in. So there's a bunch of figures here, and let's watch what Dr. John Campbell has to say. He is a doctor of nursing over in the UK, which means he has a PhD. It doesn't mean he's a medical doctor, but that's kind of irrelevant. I just wanted to clarify that. So let's see what he has to say, and then we will come back to these figures and kind of overlay what he has to say with what's going on the ground here in North Carolina.
So let's kick off with some data as we normally do, because what we normally say is how many cases there have been. So the official number of recorded cases in the UK is 293,000 officially diagnosed cases. But the Office for National Statistics indicates that the real number could be 2.8 million. And the COVID symptom tracker app indicates it could be higher than that. But I'm going to give evidence that suggests it could be 5.6 million. And this isn't too far away really, because we have thought for some time that maybe up to 10% of the UK's population could now be infected. And what is true of the UK is probably true of quite a few other countries that have had a similar recent 6 months to the UK, shall we say. Now, the deaths in the UK are recorded now to include hospitals, care homes, community, everywhere. The number of cases here as being 293,000 from testing. With 55,000 deaths, that would give us a case fatality rate, or a case fatality ratio, of 19%. So 19%, that's 19% of that number there. If that was the official number of, if the official number of diagnosed, tested cases indicated the real number of infections. But if the actual number of infections are 2.8 million, then for 55,000 deaths, that will give us a case fatality rate of 1.9%. That would be 1.9% approximately. And if the real number, as I suspect, is 5.6 million, or in that area, that's going to give us a case fatality rate of 0.98%. So in other words, this idea that there's a 1% infection fatality rate, that 1% of the people that actually are infected die from this condition. Now, more interesting data here. COVID-19 infection survey up to the 8th of July, based on blood samples. So 4,309 blood samples received since the start of the study on the 26th of April. And this indicates that 1 in 16 people, 6.3%, who provided blood samples up to the 8th of July tested positive for antibodies. So these are the antibody tests now. So this is saying, according to this data, 6.3% of the population have probably had COVID-19 based on antibody data. So that's probably the best figure we've got from the 8th of July. 6.3% of people have had the infection. But actually, if anything, this is going to be an underestimate, and we'll see why this is going to be an underestimate later. That equates to 2 million people in England. So that was where I got that first figure from. That's where I got that figure from. 2.8 million people. That's the ONS figure, based on antibody studies. It's an extrapolation, but it's based on good quality antibody studies. So 2.8 million people in England have probably been infected already. Now, memory T cells. Now, just a brief report on this, and this is what ties in the Swedish data. Now, just explain what happens here. What we have in the blood is we have lymphocytes, a type of white blood cell called a lymphocyte. And a type of lymphocyte will detect the particular virus, the antigen. And once it's detected it, it will make millions of copies of itself that can also recognize the antigen. And then these T cells will inform the B cells, another form of lymphocyte, that will actually make the antibodies. And then after a while, after about 50 days, the antibodies will leave the blood. They'll no longer be there, but the memory T cells will still be there. So a population of cells that remembers exactly how to make the antibody are left in the blood. And these are called the memory T cells. And then if the virus comes back, these memory T cells will divide up very quickly, process called clonal expansion. And we'll have millions of them, billions of them maybe, I'm not sure, certainly tens of millions of them, before the person's had time to develop symptoms, I would hope. And that means that basically the memory T cells means that people will be immune. That's the hope. Because immunity is so much more complicated than just antibodies. So memory T cells, and studies have looked for these, may mean we have more immunity than antibodies indicate. That's why I said that 3 to 4% in children there could be an underestimate. And the real numbers could be double that. The real number of children that are immune could be double that. And that's based on work from Stockholm. Now, just before we do this, remember we got data from India that said the IgMs come first. They're the immediate antibodies, and the IgGs come later. But even the IgGs, the immunoglobulin type Gs, are only in the blood for about 50 days. But the memory T cells, we would hope, would persist. And studies in Stockholm, what it showed back in May was that 15% of people they studied had antibodies, but 30% had memory T cells. Now, the test for memory T cells is complicated because you're looking for a particular type of memory T cell that remembers how to make antibodies to the coronavirus. So it's a complicated test. I've never even seen it done myself, but I've seen lots of blood tests done in laboratories otherwise, but never that specific test. But they did that in Stockholm. We can do it in the UK. It's a bit tricky, but it needs to be done. So in Stockholm, 15% had antibodies, but double that amount had memory T cells. So, getting back to our original supposition here at the very start of this video, if you're still with us, the Office for National Statistics, this is based on testing here. But given that the real number of patients could be double, I know this was based on antigen testing, but the real number of patients could easily be double, which would give us that number there. And if that number there is correct, that gives us, as we've always expected, round about a 1% infection fatality rate. So just kind of putting those two bits of research together, that is a supposition I'm making. But that's based on research. Double the amount have immunity compared to the amount that have the antibodies. So what this means is that immunity is more complicated to work out than just the antibodies. But we're still well under the amount of people that need to be infected to give herd immunity. So unfortunately, as we said yesterday, we are still near the start of this pandemic, unfortunately.
Okay, so we're back, and having listened and seen the figures that Dr. Campbell has explained, let's overlay that data over, or that formulation, I guess would be a better word, over what North Carolina is experiencing. So North Carolina has currently, as of today, July 24th, 2020, 109,272 positive cases. According to Dr. Campbell's data that he has gleaned from various sources, the true number of cases according to antibody collection or analysis of blood samples for antibodies is 9.5 times greater than the total number of positive cases in the UK. And as he points out, he feels that that multiplier will be typical among Western countries. In other words, those countries in Western Europe and in America, well, the United States, will be similar because they have similar healthcare systems, and so therefore you can expect similar results. So positive cases, 109,272, multiply that by 9.5, which is the multiplier I got from what his figures were for the UK, gives us 1.04 million people, the number of true cases in North Carolina. And if you looked at his T-cell citation, then it is double that, nearly, at 2.07 million people. Number of deaths in North Carolina is currently 1,778. So if we look at the percentage of deaths compared to the true number according to antibody collection and analysis, it is 0.17%. If you look at the percentage of deaths compared to the research regarding T cells, it is 0.08%, which means both of these percentages are pretty good. Which means if you have a test for COVID-19 and you test positive, then you have well over a 99% chance of surviving. Either 99.83% or 99.92%. Those are pretty good odds. Now we look at the recoveries. In other words, North Carolina has an official number of recoveries. I've done my own spreadsheet. My total number of recoveries is a little bit lower than what WRAL's is, but I assumed a 30-day lag time between getting infected and getting well or dying. Obviously WRAL is using a shorter time frame than that, but I was more conservative. But let's just go with what WRAL is reporting. The true number, number of recoveries is 78,701. The antibody true number of recoveries is 751,594. The T cell number of true recoveries is about double that, or nearly 1.5 million people. So North Carolina population is 10.5 million. The 70% herd immunity figure, you know, may or may not be valid. That's what Dr. Campbell throws out there. He's got the PhD and I don't. So it's 7.35 million people, which means that's how many people need to be infected and recover before this virus is actually stopped in this state. In other words, once you get to 70%, the virus it doesn't have enough people left to infect in the amount of time it has to infect them in order to continue to spread. And of course the time factor is very important, because the virus has a couple weeks to go from one host to another. And so it's not like the virus is out there for a year or two waiting for a chance to infect people. It has a limited shelf time. So the recoveries to herd immunity antibody true number is about 6.6 million people. So if the antibody true number of cases is this, then this is how many people we need actually to be infected before we reach herd immunity. If the T cell number is actually the true number, then we need 5.85 million people to become infected. So even though, and I did edit that video heavily, and I didn't do that to try to draw a false conclusion from what he was saying. I edited the video for time. He talked about a number of other peripheral issues that weren't really pertinent to what I want to talk about. But his conclusions, I fairly applied his conclusions to what is on this spreadsheet. So we are, about 6 million people to go. And that's just the way it is. Once 6 million more people get this disease and recover from it, we will be done with this disease. I think the takeaway for me on this is this disease is far more pervasive than anyone really truly understands, and there really isn't a whole lot we can do about it. And the thing we have to be thankful for is that the number of deaths is so incredibly low compared to what it could have been. In fact, it's incredibly low to what they are experiencing in England. And I don't understand why the number of deaths in Western Europe is so much greater than they are here. I have even looked at the US figures. They are a third of what Europe is experiencing. And so this is all, we're in a pandemic. I mean, things can be really bad, or they can be not as bad, and they are not nearly as bad as they could possibly be. So, if you have any questions or comments, leave them in the section below. Like and subscribe. We appreciate when you do, and we'll see you on the next fact-filled video.